Hi, today we are going to talk a little bit about a bit more sort of a serious, a bit more somber topic. It's a topic on euthanasia. Euthanasia comes from the Greek word good death. We are the only profession in UK that actually discusses it and also performs it. I don't think there's any other profession that does that. It is a very sensitive topic, as you can imagine. And for those watching this video, you may have had your pet put down before. And it's fairly profound how it makes you feel. It changes you. And that is important because it only does that because you really care for your pet. So today I'm going to talk a little bit about how do we perform euthanasias. So for people who have not been through one before, this may be what you can expect when you have to bring your beloved pet to the vets for the final farewell. So usually I would sedate them. So I'll give them a little injection, and that usually goes into the muscle, and it just keeps them a little bit calmer and a little bit quieter. They can sometimes even lie down and just sort of almost fall asleep, or it can just take the edge off to just make them a little bit easier and more compliant, so they're not going to struggle when you're trying to give the second injection. Most of the times they can sit on the owner's lap, okay, and all we need is a vein on the front leg. So some owners prefer the animals to be sitting on their laps, some owners prefer the animals to be lying on the floor, some owners prefer the animals to be lying on the table. So it really depends, but we can certainly accommodate that. Then usually we also shave a little bit of hair for a dog and cat on the front leg to expose the vein, and that is where we are going to give the overdose of anesthetic. As the name suggests, it is an overdose of anesthetic, so our little pet here, they would fall asleep and not wake up. The definition of overdose of anesthetic. They will sometimes feel the prick of the needle, just like any other needle, but usually they just glide quite smoothly off. Very, very occasionally, in a very, very small proportion of pets, they may take a deep breath or they may gasp a little bit. Usually, in my experience, they're gone by then, but it's just their reflex kicking in. So for owners that see that, don't be too surprised, because it doesn't mean that our little friend there is struggling or anything like that. A small proportion of animals also, when they fall asleep, everything relaxes, so they may defecate or urinate. So also don't be too surprised when you see that. And how long it takes for the injection to be injected before the animal falls asleep, it really varies, but it's usually pretty quick. We talk about sort of one brain circulation time, or simply in a matter of seconds. And you may find that some animals, they may need less of the anesthetic than other animals, and that is a procedure of its own, really. So for those who have had pets being put down before, or being euthanized before, being put to sleep before, you may have seen this sort of the procedure itself. For those that have not, this is a little brief description of how the process would be like. It is also very important to realize that this is not everything, because even when the animal has left us, we are left with our feelings. It's very important to acknowledge that and recognize that, and if really needed, and I highly advise that, have a chat with your vet or with a pet counselor. There are plenty of useful helplines for people to discuss in terms of bereavement and things like that. But certainly what I have found is that it is quite important, and that's where I felt vets, we can make the most impact in understanding that and being sympathetic with that. And sometimes it could be days, weeks, or even months before the owner comes back to say that, you know what, can I have a chat with you a little bit, because I'm still having problems, grieving, or just simply trying to hold what is no longer there. and it can be quite difficult. So many people, you know, they process it differently. If you have any sort of personal experience like this, please do comment below, and we'll be happy to answer any questions. But if not, till the next video, take care.